On a personal level, what moments or experiences remind you why this work matters so deeply to you?
I would say definitely if we're looking at what's happening in the US and globally, it shows there's a lot more work that needs to be done to dismantle systems that oftentimes marginalize and oppress people. How can we really ensure that we're addressing a lot of the systemic barriers that are still in place?
What does a truly equitable future in global health look like to you?
For me, I think a truly equitable global health future is one where power and decision making is shared, where the communities that are the most affected by health inequalities are the ones that are driving the change, defining what the priorities are, leading the research, as well as shaping the solutions.
Welcome to the 72 Dragons Global Health Interview Series, where we connect with inspiring healthcare leaders worldwide to explore their journeys, insights, and impact in shaping a healthier, more equitable world. Public health is not just about system, it is about people, purpose, and the power of progress. Before we begin, take a moment to reflect. What does it take to turn purpose into progress? How does one person's journey create ripples of change across borders? Today, we're honored to welcome Lanice C. Williams, a global health and gender equality professional with over a decade of experience advancing health equity across the United States, Africa, Latin America, and the Caribbean. As Director of Advocacy, Communications, and Partnerships with Data2X and Chair of Women in Global Health DC chapter, Lanice's work continues to empower communities and inspire future leaders. Join us as we explore her journey of purpose, advocacy, and impact. Lanice, welcome. It is a great pleasure to have you with us today.
Thank you for having me, Dr. Pietro.
Lanice, as a proud Howard University alumna, how did your experience studying biology and public health education, shape the way you think about inclusive and equitable global health systems today?
Thank you so much for that question. I would actually say Howard was a part of my journey, but it's actually from my time living back home in Jamaica that actually helped set part of the foundation for how I view inclusive and equitable global health systems and what change we need to see. But if I talk about my experience at Howard, I would say it really laid the foundation for my academics, but also how Howard views the world as well as the part that Howard students play in the global community. I would say studying biology and public health there, it's really grounded in the university's motto of Veritas e Utilitas, which means truth and service, which taught me that education is one of the it's most powerful when it's both rigorous but also rooted in community. I would say this phrase has stayed with me not only as a student at Howard, but also in my career and as who I am as a professional. For me, truth reminds me of the importance that evidence, data, scientific integrity plays, while service, of course, underscores our responsibility to apply that knowledge in a way that really helps to uplift others, but more so being of service of your community at home, but the global community as a whole. I would say from studying at Howard, particularly from my master's in health education, which is rooted in public health, it was more so not about studying the systems, but also understanding the social and structural realities particularly that determines who can access health and who does not. As we know, inequalities plays a big role and is a big barrier sometimes why we see communities that are oftentimes marginalized and disenfranchised do not have access to health, but of course, education, economic opportunities, and so forth. I also think the university's commitment to both academic excellence and community engagement also instilled in me the belief that equitable global health systems must be built on truth, guided by service, must, of course, take into account the voices of the communities that you're serving because they also know what they need more than you as coming in as the expert, and they just need you to provide the way for them and the funding so that they can create the change that they want to see.
Thank you for sharing your journey. Now, you have dedicated your career to advancing equity and empowerment. On a personal level, what moments or experiences remind you why this work matters so deeply to you?
I would say definitely if we're looking at what's happening in the US and globally, it shows there's a lot more work that needs to be done to dismantle systems that oftentimes marginalize and oppress people. How can we really ensure that we're addressing a lot of the systemic barriers that are still in place? I think also what continues to keep me grounded is the voices and the stories of the communities that I have been able to work closely with, particularly those of women and girls and gender diverse people that I've met through my work. Many of them, of course, despite systemic barriers, continue to lead, innovate, as well as create changes for their communities. I've also seen how access to resources, representation, or simply being heard can truly transform lives. Of course, this work is not easy. It does get challenging at times, but I'm oftentimes really grounded in my why. For me, part of my big why was seeing what my late grandmother did as a leader in her community back in Jamaica, the importance of advocacy and how advocacy can really create the change that we want to see. Of course, we know systems, when we're trying to change systems, we know also the policies that are put in place oftentimes can either improve those systems or make those systems quite challenging as well. And we see sometimes policies change as changes in politics and administrations also come forth as well. So yeah, I'll kind of stop there, but I'll also say, it's about justice and creating a world where opportunity isn't just determined by gender, geography, or one circumstance.
Now, in your leadership roles with women in global health, Washington, D.C. chapter, and as a commissioner with the D.C. Commission for Women, what strategies have you found most effective in building coalitions and partnerships that lead to real lasting progress on gender equality?
Yeah, no, thank you for that. I would say the most effective coalitions are built on trust. I think trust is definitely important, respect, a shared purpose, as well as intentional inclusivity, meaning creating spaces for all voices to be heard. I would say in both of these roles, I've really learned that real progress comes when we bring diverse voices to the table, especially those that are oftentimes overlooked, and create spaces for them to lead. For me, partnership is just doesn't mean everyone agrees on everything, because we know when you work in coalition, particularly when you represent your organization, each organization has their different priorities, but it's about what is the common goal and how can we all move towards that same direction, our commitment to that. I've also found success in aligning around concrete, actionable goals and maintaining transparency. And of course, we know we should always celebrate small wins, not only the big ones. So I would say those are some strategies I found that has been very helpful in lasting progress. I mean, it would be remiss of me not to acknowledge what we're seeing globally, right? The rise in anti-gender movements, the rollback on certain policies and things that have been put in place, which also is quite challenging, which I know myself and many other coalition members are trying to reevaluate and see like, okay, we have this great momentum. What can we be doing to protect the gains, to ensure the gains that has been achieved is not lost? But we do know some things will set us back. But it's all about, okay, well, we're trying to all navigate this time. What are the changes that we need to create? What are the things we can protect? And how can we move forward collectively?
Thank you for sharing the strategies that have been helpful to you. Now, talking about mentorship, you have invested deeply in mentorship through programs such as Women Lift Health and the United Nations Association of the National Capital Area. What key lessons or advice do you share with young women who want to lead and make an impact in global public health?
Yeah, for me, I think mentorship is big. In addition to mentoring, I also do believing in sponsoring. Like, if there's a way that I can speak about someone, maybe in a room that they're not in, and open a door from them, I think that's a big thing for me. I tell all young people that you don't have to have all the answers. Trust yourself, believe in your capabilities. You're there for a reason, but also being willing to be open, remain open. Like, we all have goals, we all have things that we want to achieve, but sometimes life isn't about a straight linear path. There are detours. I know I've taken many different detours throughout my career, but I'm grateful for where I am currently. But of course, we all always want to strive to be able to do more. Of course, beyond that, listening deeply, using your voice to open doors for others. All of us got to our career not by ourselves. There was someone who saw us and opened a door for us. So never be afraid to reach behind and pull forward someone else with you. I would say, of course, seek out other mentors, seek out sponsors, of course, people who would not only guide you, but also advocate for you when you're not in the room, as I earlier mentioned. And one thing for me, I always believe that your lived experience matters and it's a part of who you are. And many of us that are working in public health bring our lived experience to the work, because we're either from that particular community that we're trying to create change in. And I would say the global public health field also need leaders who truly understand intersectionality and the intersecting identities that people bring and how it affects and shapes their lives. But also we need to see people lead with more empathy, conviction, as well as courage.
Thank you. Great advice. Finally, as we look ahead, what does a truly equitable future in global health look like to you? And what do you see as the biggest opportunities and challenges for the next generation of health professionals working toward that vision?
For me, I think a truly equitable global health future is one where power and decision making is shared, where the communities that are the most affected by health inequalities are the ones that are driving the change, defining what the priorities are, leading the research, as well as shaping the solutions. Of course, it's a world where we not only achieve gender equality and equity, but it's not an issue that is siloed. It is something that is quite a central pillar of how we design systems and measure success. Because, of course, gender is a cross-cutting issue. It cuts across health, it cuts across energy, climate, education, so many different areas. So that's one thing I would add. I would say challenges, of course, that may continue to persist would be resisting systems that still privilege the few over many. I know that will need to change, but however, I'm quite optimistic that these new generation of leaders in the health space, particularly the global health field, are not just going to demand change, but they're going to drive that change as well as be building it. And then, of course, Other opportunities that exist for the next generation is the ability to leverage technology and data and advocacy to drive accountability and inclusion at every level.
Great. So many future opportunities. Lanice, thank you for joining us for this inspiring conversation on leadership, purpose, and global health. At 72 Dragons Health, we are proud to spotlight the change makers shaping a healthier, more equitable world. Thank you.
Thank you.
Now, we would love to hear from you. How can we make global health programs more inclusive and gender responsive? What role do you believe young professionals can play in driving health equity and social change? Share your thoughts with us in the comments below. If you enjoyed this conversation and want to hear more inspiring stories like Lanice, do not forget to like, share, and subscribe to 72 Dragons Health. Together, let us keep the conversation on equity and empowerment alive.